Hi, I'm Garrett Sanders. I'm one of the pediatric dentists here at PDA&O. And today we're going to talk about the difference between crowns on baby teeth and permanent teeth and clearing up some misconceptions that parents often have based off of their experiences with the crowns and how that's going to be different from what their children may experience during their appointment here. So one thing that we commonly run into here at the office is when a child has a crown, which is either stainless steel or a prefabricated ceramic crown, the parent a lot of times has some bias baked into the idea of a crown based off of experiences that they may have had themselves. And what a lot of people don't realize is that there's quite a bit of difference between a crown placed on a baby tooth versus a crown placed on a permanent tooth. And so what I would like to do today is to clear some of that up and to kind of put people at ease that it's not nearly as involved as maybe they're imagining that it's going to be. So anyone that's had a permanent crown tooth placed on themselves knows that it's frequently a multi-appointment process with a lot of drilling and impressions and steps, and it can be, fairly invasive and it can be fairly uncomfortable. And it is something that takes a lot of time and it can be costly as well. And what I want to explain today is that most of the experiences that you would have had having a permanent crown placed do not apply to the placement of a tooth or of a crown on a primary tooth or a baby tooth. Whenever we do crowns on baby teeth, our main mission is efficiency and timeliness. So children don't have a super big attention span or tolerance for dental procedures a lot of times, and we know this, and so we don't want to labor over anything if we don't have to. So we're trying to be efficient for you and your child so that we can keep them comfortable. And because of that, most baby tooth or primary tooth crowns are prefabricated, which means that we have an assortment of sizes that fit pretty much all tooth sizes that you're going to encounter in the average mouth. And that allows us to be quick. So we prep the tooth and then we utilize one of the 6 or 7 prefabricated sizes and we fit that crown to your child's tooth, chair side, and it's very efficient. And so there's no impression, there's no lab fabrication required, there's no follow-up appointment required, and it allows the entire procedure to be completed in minutes rather than hours or over the course of multiple days. Whenever your child comes in for the appointment, they would receive anesthesia just like they would for a filling or extraction or any other invasive dental procedure. Once the tooth is numb, the preparation portion for placing a crown on a child is very brief. So in sometimes under a minute, the preparation can be completed. You're removing just a little bit of tooth structure to create space for the crown to fit over the tooth. That's done quickly. It's just a little bit of vibration. The teeth are numb. The child typically does not respond to that. They're usually just watching their movie. You get through that quickly. Once the tooth has been prepared and space has been made for the crown to be able to fit over it, then we start selecting, and we've all gotten pretty good at just looking at the tooth and knowing which one of the sizes is going to fit. So usually there's not a whole lot of trying on and off. You pick a size, you place it. If it fits, you place the cement, you glue it on, and you let it set for just a second, and then the child is done, and the appointment is very concise and then out the door with no follow-up. And so I hope that kind of puts some of the misconception to rest and gives you some peace of mind that it really isn't that big of a deal. And most kids tolerate the crown procedure identically to a filling procedure. And from their standpoint, they don't know any different, and it works really well. So if you find yourself with your child having an upcoming appointment for a crown procedure here at our office and you feel like you have additional questions that we haven't answered for you today, feel free to contact one of our clinical personnel at either one of our offices at any time, and we would be happy to answer those questions for you.